Thank you for staying here on News Desk with me, Bernice Abubeidulansa. Now, founding president of Imani Africa, Franklin Kujo, has chastised government officials backing the contract to deliver blood and essential medical supplies with drones to rural areas of the country. He's not alone. Many groups, including the Ghana Medical Association and the minority in parliament, have said the deal is not giving value for money. Now, let's get the opinion and some insight from a procurement expert and supply chain specialist, Kobna Atabedu. Thank you so much for joining us this morning.
Thank you for having me.
First off, what are your reservations about this particular deal?
Okay, so I'll start off by saying that I am not against the use of drones for healthcare delivery. It is not a bad thing. However, the process of acquiring the service could have been done better to give us more value. Now, you hear people make comments on social media and on traditional media that if you have to spend money to save a life, what value can we put on a life? Water, they say, is life. The fact that we need water to exist doesn't mean that if I know that a bottle of water sells for 1 cedi, I should pay 100 cedis for it. It doesn't make sense. And that is why I am saying that we need to go back and look at the value for money aspect. The basis, as in its essence, is a red herring, neither here nor there. But the value for money part is what we have to look at again.
So what exactly are your concerns? Is it with how much or how long? Or what exactly are your concerns about the drone deal?
So I am a procurement expert. I'm a professional. How we practice the profession is a concern for me. We are using procurement to do a lot of things. That is not right. That is not how it is done as a profession globally as best practice. So I'm going to take a backstage to the principles. And I want us to look at a few slides. The first one, which is the secular slide of a category management tool. Now, with this slide, what happens in stage 1 is when you are evaluating the category. So healthcare is a category. You pick that and you evaluate it. Then out of that, you move to stage 2, where you are building your business requirements. So in the contract, I have cited a contract. I see an annexure that has a map of Ghana with 4 areas where the 4 DCs are supposed to be. I'm wondering if that is just an aerial map that was taken, or there are numbers behind it. So if you tell me that we are going to put 4 distribution centers and we are going to do 150 deliveries every day, there must be on the ground the need for the movement of 150 drugs or deliveries on the ground. On an emergency basis, because this is not business as usual. This is for emergency, it's a stopgap. So there must be data to support that. I would have loved to see the data that supports that need. Then, normally in category management, by the time you are done specifying what your business requirements are, you go for an approval. Then you would now come to the supply market and analyze the supply market.
Okay, that's the third point.
That's the third stage. Now, who is in the market who can deliver this? How do they deliver it? How do they build their pricing to come to the price we would get?
And now, the argument there has been that
the sole source
Fly Zipline is the best around the world. That's the argument we've heard from the health ministry.
The argument has been that they are the only one in Africa. But this is a global market. It is not a local market. So Zipline their expertise is in Rwanda. So they are not a local contractor. So if you can open up to Zipline from Rwanda, you might as well open up globally and let it be international competitive bidding. Now, there are 3 top players in the drones market as of today. Zipline is one. Fletty is another one. Matanet is another one. Matanet is working on drone deliveries with Mercedes-Benz. So you can't tell me that they don't have capability. So if you had opened up to these people, there are 3 other companies that can easily do this. One from Iceland, one from China, and one from another country I've forgotten. So if you wanted competition, we could get competition. That's the first point. Then you come to the market and I begin to look at the commercial models. I hear Dr. Nsiasari say that this is a fee per service. So it's $17 per delivery. I go into the contract and I look at it, and it is clear that it is not a fee for service. It's a fixed contract. And the annexure that supports it makes it clear that we are paying a fixed amount of money every month based on the table they have set. So if we look at the details of it, So if we go to the Excel slide,
okay,
the table says that where we do 15, less than 15 deliveries, we are not paying. It doesn't make sense. Now, per the contract, the guys are bearing the cost of setting up the DCs.
Okay.
That is fixed cost and variable cost. Nobody will set up a DC and come and fold his arms. And if you haven't given him volumes, he will say, I'm not charging you for it. So it doesn't make sense in the first place. At best, at zero, your cost is higher because you have to cover the fixed and the variable cost to a certain extent.
Just a bit of clarity here. So you're saying that in that contract, you interpret the information there to mean that it's a fixed contract and it's not based on service delivery?
No, it is expressly stated.
It is expressly stated. Okay. Now, you're referring to this 15 deliveries per pay. Someone will argue that, but that means that until the service is rendered, you're not paid.
There are clauses on how they invoice.
Okay.
And at the end of every month, they'll work the math and invoice. If they are invoicing above 15 deliveries, the fixed cost is 11,000 cedis.
Okay.
That it's 9,000 cedis if they don't do 90 deliveries. It's 10,000 if they don't do 90 deliveries. It's 11,000 if they do 90 deliveries. Now, take that 11,000 and divide it by the 15 deliveries or above 15 deliveries. The unit cost of a delivery is $700. $733 to be precise. Move to the next level. If they do 50 deliveries, the charge is $27,000. Divide $27,000 by 50. The unit cost is $540. But the interesting is the next level. When they do 75 deliveries, the cost is $59,000. Now, if you divide it, the cost is now $786. Okay. Now, at 786, you ask yourself, in economics, as you consume successive units, the cost should be going down. Why is this one going up? When you get to above 100 deliveries per month, you are paying $88,000. The unit cost is $880 per delivery. So where is the $17 per delivery coming from? Someone has to help me understand this. It doesn't make sense to me. Let me backtrack and take the numbers as were announced. It's a $12.5 million contract. It's a 4-year contract, 48 months. Divide 12 million by 48 months. You get 416.67. That's the cost per month. Okay. If they say that the unit cost is $17, divide that 260 by 17. The cost per month is $15,000.
Okay.
Divide by 30 days. The cost per day
is 510.
Now, this doesn't work. This number here, no, the volume of deliveries here is 510. It doesn't add up to what Rwanda is doing today. Rwanda started operation in October 2016. I have read a report which was published in May. So as of the end of April, they had done 5,000 deliveries and on a payload of about 7,000 kilos, 7 tons. Now, over that 20-month period, it meant they were doing 250 per month. If you divide that 250 by 30 days, they are doing about 8 deliveries a day. So if Rwanda is doing 8 deliveries a day on an emergency basis, because their cold chain management system probably works better, what statistics is informing us doing 500, planning for 500?
Okay, and we don't know, so we cannot make a judgment on that now.
So they have to come again. These are all the gray areas, all the questions we are asking. Now, if we take the contract itself and we begin to analyze the contract, there are lots of questions you ask yourself in there. For example, we have an Exchange Control Act that says that we shouldn't even quote in USD. You are signing a contract with a locally incorporated company. Why would you quote in USD? Why is this a dollar-based contract? Okay. So we are breaching our own law. So if we take the contract itself and begin to go into it clause by clause, there are lots of questions they have to come back to answer.
So what would you recommend now? We've heard from Deputy Minister of Information, Pius Hadide. He says there's no going back to this. Parliament has approved it. what we're going to do is to engage stakeholders to explain further what we hope to achieve with this deal or contract. What would you recommend?
I'll explain to you why there's no going back to this. The contract has a provision for termination, and it terminates only for cause. It doesn't terminate for convenience. So they don't have the luxury of going back to terminate for convenience. That is why they are compelled to keep it. As soon as Parliament approved it, it came into force. So they are obliged to run the contract as of today. The best they can do is to go back to renegotiate it, and that is what we are asking for. We haven't said we don't need the drone service. We are saying we are paying an arm and a leg. They should go back and do the work well.
It's interesting. You say the current government cannot or is assuming that posture because of a certain clause in the contract. We've heard from the opposition.
I can't speak for them. I don't know why.
Of course, yes.
I'm conjecturing that based on that clause alone, it is difficult for them to backtrack now that it's in force.
Of course. But we've heard from the minority, and they say that, look, if we come into office, we're going to scrap this deal. Will that come at a cost for us?
If they come into office and they look at the contract, and they would see if there's any loophole for them to scrap it without any judgment debt. Because the guys are going to fund the acquisition of land, the building of the distribution center.
And sorry, when you say the guys, who do you mean?
Zipline, sorry.
Sure.
Zipline is going to fund the lease of lands, the building of the distribution centers, the building of the drones, and of course, its decommissioning. If you decide to terminate it, there are costs already. And in the contract, the survivability of the contract leaves itself some terms that you have to go through it. There are certain obligations you can't run away from even if you terminate. So it's not as simple as that.
Let's take off your coat as a procurement and supply chain expert, and let me talk to you as a Ghanaian.
As a Ghanaian.
At this time, do you, let me just put it this way. What is your take on this drone system at this time?
Okay. We have a challenge with our cold chain management system. If we were planning, as in procurement planning, supply chain planning, we know the number of health centers we have. We know the various grades. We know which health center can hold what drug. From the central medical stores, they should be able to plan and move drugs to these places. So everybody has a cold management system and is able to hold his drugs. In that case, we won't even need the drones. The reason why we need a drone is that if a snake bites someone at Domiabra, the nearest CHIPS compound is 20 kilometers away. And the CHIPS compound doesn't have a cold chain system to hold such drugs. So you need a drone to move it from Konfanochi or the nearest tertiary or secondary point. Exactly. That is where the drone comes in. So the drone can replace the cold chain management system we need for healthcare management.
But we are being told that this is not a replacement. In fact, when I hosted the PR of the Ghana Health Service, he told us that what they're doing is to upgrade the health system on a general basis. So, for example, he thinks it's quite unfair to assume that because we are doing the drone system, we are neglecting other aspects that need attention within our health system.
If we are planning on doing 150 deliveries per distribution center per day, unless I'm wrong, and you compare it to Rwanda doing 8, then there's a big question mark. Why do we have such a huge volume? What a huge need? Then there's something fundamentally wrong with the way we are managing our healthcare.
Let me ask you this. Are we complicating our health system with the introduction of this drone deal?
I won't say we are complicating it. I think we are putting too much cost on and that is where I think I've heard the medical guys come in from. That, listen, before you move the drug, we need a theater. You bring us the drug and we don't have a theater. How do we administer it? So give us a theater. Give us oxygen. You understand? So there are basic infrastructure that we need to put in place. And this one comes as a complement to what we have.
Finally and briefly, Mr. Atabedu, I would go back to that question. So what do we do now? The thing has been approved. What can we do to ensure, like you say, we get value for money and this is not a total ripoff?
Okay, here's my take. we can always, a contract is signed by two parties. When the two parties agree to review it, they can review it and no one will carry any liability. A liability may come in when the person has made commitments that if you change everything, it affects him. So you have to compensate him for it. That is why there are provisions for liabilities in the contract. If we can do that, we won't have a problem. Then we can revise all this. If we can't, then someone has caused financial loss and someone has to respond. There are professional people and bureaucrats in the system who should be guiding the process. Someone has to respond to this.
Thank you very much for your time this morning. Kobna Atabedu is a procurement and supply chain expert, and he's been sharing his thoughts on Ghana's medical drone deal. Basically, he disagrees with the sole sourcing model and a lot of other things. If you just joined us, get onto YouTube and watch the full interaction and discussion that we've had here.